Have you ever considered how a microscopic entity could redefine an entire society? Today we delve into the profound impact of COVID-19 on British society. Picture this. It's the end of January 2020 in the United Kingdom. A novel virus, previously unknown to human science, has just been identified in 2 individuals. These are the first reported cases of COVID-19 on British soil. A sense of unease pervades the air as news channels broadcast images of masked individuals and deserted streets from far-off lands. As the days roll into weeks, this distant threat morphs into a palpable reality. A veil of confusion descends. Questions abound. What is this virus? How does it spread? How deadly is it? The answers are as elusive as the virus itself. The nation watches, waits, and wonders. Meanwhile, the government grapples with its response. Caught between the Scylla and Charybdis of public health and economic stability, the initial response is cautious, considered. Yet, as the gravity of the situation dawns, the gears of bureaucracy begin to turn with increased urgency. Public reaction mirrors the government's evolving stance. Initial apprehension gives way to a growing sense of alarm. Yet amidst the uncertainty, there are flashes of quintessential British spirit, the stiff upper lip, the dry humour, the unity in adversity. The virus, however, is unimpressed by human resilience. It continues its silent, relentless march across the UK, indifferent to borders, oblivious to social status. The numbers start to climb, first slowly, then rapidly. The UK, like a ship in a storm, braces for impact. And then, as March dawns, the reality hits. COVID-19 is not just a distant threat, it is here on our doorsteps. It is in our communities, our hospitals, our homes. The UK, like the rest of the world, is in the grip of a pandemic. As the virus took hold, the UK, like the rest of the world, began to feel the tremors of a looming health crisis. The UK's healthcare system, revered worldwide, found itself in an unprecedented predicament. As the COVID-19 pandemic took hold, the National Health Service faced a crisis of epic proportions. A system designed to heal and mend was suddenly under a siege, the likes of which it had never seen before. Hospital capacity, a concern even in normal times, became a critical issue as the virus spread with alarming speed. Wards filled to the brim, intensive care units stretched beyond their limits, and the system teetered on the brink of collapse. The spectre of rationed care, a notion alien to the UK's healthcare ethos, loomed ominously. But it wasn't just the physical infrastructure that bore the brunt. The human face of healthcare, our doctors, nurses, paramedics, and support staff, were pushed to their physical and emotional boundaries. The relentless pace, the sheer magnitude of suffering, and the constant risk to their own health took a heavy toll. Yet they stood firm, braving the storm with courage and determination, embodying the spirit of the NHS. As the battle against the virus raged, another monumental task was underway: the vaccination programme. A race against time, this was the largest and fastest inoculation campaign in British history. The logistics were mind-boggling: millions of doses to be administered, a population to be prioritised, and a mammoth information campaign to combat vaccine hesitancy. The healthcare system rose to the challenge, displaying an extraordinary level of adaptability and resilience. Vaccination centres sprouted in town halls, pharmacies, and even cathedrals. Healthcare workers, retired professionals, and an army of volunteers joined forces, working tirelessly to turn the tide. The resilience of the healthcare system would be tested to its limits, but the real impact of COVID-19 was just beginning to unravel. The strain, the sacrifices, the triumphs, and the heartbreaks, all these painted a vivid picture of a healthcare system under siege. But this was just the beginning of the story, as the full impact of the pandemic on British life was yet to be fully understood. COVID-19 didn't just attack our health, it launched an assault on the economy too. As the nation went into lockdown, businesses across the UK were forced to close their doors. The bustling streets of London, Manchester, and Edinburgh became ghost towns overnight. From the corner shops that form the backbone of our communities to the multinational corporations that power our cities, no business was immune from the economic turbulence. High streets, once the heart of local economies, saw an unprecedented number of closures. Retail giants toppled, while independent stores struggled to keep their heads above water. The hospitality industry, a vibrant part of British culture, was hit hard, with many pubs, restaurants, and hotels unable to weather the storm. Yet it wasn't just businesses that bore the brunt of the economic fallout. The ripple effect of these closures saw unemployment rates skyrocket. Millions found themselves without work, their livelihoods swept away in the tidal wave of the pandemic. The hardship was palpable as families grappled with a future filled with uncertainty. In response to this economic crisis, the government stepped in, launching an array of financial aid packages. The furlough scheme, for instance, helped keep millions afloat by covering a significant part of their wages. Business loans and grants were rolled out to help struggling enterprises. While these measures provided a lifeline for many, they were not without their controversies and criticisms. The economic impact of COVID-19 is a story that goes beyond pounds and pence. It's about the dreams of entrepreneurs put on hold, the workers who had to adapt or face redundancy, and the communities rallying together to support their local businesses. It's about resilience in the face of adversity and the creativity that emerges when traditional ways of doing things are no longer viable. The economic aftershocks of the pandemic continue to be felt, but there's more to this story than just numbers. The virus has not only changed our economy, but our social behaviors as well. The COVID-19 pandemic has propelled us into an era of change, and British society has not been left untouched. We've seen a significant shift towards remote work, with people trading office spaces for home offices. This change has not only affected how we work, but has also transformed our daily lives. For many, the morning commute has been replaced with a simple walk to the next room, and business attire has become a thing of the past. Meetings have moved online, and water cooler chats have turned into virtual coffee breaks. This shift has been accompanied by its own set of challenges, with many grappling with the blurred lines between work and home life. The education sector has mirrored this shift, with classrooms moving onto screens. Children and young adults alike have had to adapt to online schooling, a change that has brought about its own set of challenges. The lack of face-to-face interaction and the pressures of remote learning have had significant impacts on students' mental health. As if the virus itself wasn't enough, the social distancing measures put in place to control its spread have had far-reaching implications. The simple act of shaking hands, once a common social practice, has become a potential health risk. We've traded hugs and handshakes for nods and waves, and masks have become a staple in our wardrobes. The mental health implications of these changes cannot be understated. The isolation, the fear, the uncertainty, all these factors have contributed to a sharp increase in mental health issues. The pandemic has forced us to confront the fragility of our mental well-being, and it's a conversation that continues to evolve. The pandemic has changed how we live, work, and interact, but it has also shaped how the government responds. As we continue to navigate this new normal, it's clear that these social shifts will have lasting impacts on British society long after the virus itself has been tamed. As the nation grappled with the new reality, the government's response became a defining factor in the narrative. The British government was thrust into the spotlight, its every move scrutinised and analysed by a nation on edge. In the face of an unprecedented crisis, the government took measures to protect public health that were equally unprecedented. A nationwide lockdown was imposed, a move that was met with a mixture of understanding, frustration, and fear. The streets of cities like London and Manchester, usually bustling with activity, fell eerily quiet. Yet, even in the midst of this sweeping change, the government's communication strategies were consistently put to the test. The daily press briefings became a fixture in the lives of many as people tuned in, eager for updates and guidance. The messaging was not always clear, leading to confusion and, in some quarters, mistrust. The challenge of balancing the need for transparency with the desire to prevent panic was a difficult tightrope to walk. Public sentiment, too, has been a whirlwind. Emotions have run high, with the government both praised for its decisive actions and criticised for its perceived shortcomings. The road to recovery is still unfolding, with many challenges yet to be faced. The question of how to revive the economy without jeopardizing public health remains a key concern. Schools, businesses, and public spaces are gradually reopening, and yet the spectre of the virus still looms. The government's role in steering the nation through this delicate period is critical. In the face of these challenges, there are signs of hope. Vaccination efforts are in full swing, and there is a sense of cautious optimism in the air. The road to recovery may be long and fraught with uncertainty, but there is a determination to endure and rebuild. The impact of COVID-19 on British society is a complex tale of resilience, adaptation, and hope amidst adversity.